Hello, everybody. This is Gary. Today is January 16th, 2022. It is 6:15 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. I went to the emergency room this morning at about 4:30 in the morning because when I got up, I had a lot of blood coming out of the tip of my penis, and it was soaking my underwear. So I called the emergency room or the ambulance, and they came and got me. And I went to the University of Rochester Strong Memorial Hospital where they ran some tests. Um, the bleeding didn't seem to be as severe as I thought. I didn't find any blood in my urine. Um, but it was kind of scary to wake up at 4:30 in the morning to go to the bathroom and find out that there was blood all over my hands and blood all over my underwear from my penis. Um, it's kind of a scary thing. Turns out it wasn't that serious. I have had uh, surgery on my urinary bladder and my prostate, and I have had bleeding before, but not quite as severe as it looked this morning. Um, I am scheduled to see my urologist on December 2nd, I believe, for what's called the cystogram because of my seeing blood when I urinate. They're going to lubricate a probe with a camera on the end and insert it into my urethra and take a look around at my bladder and my prostate and see if there's any cause for the bleeding that occurred both this morning and over the past few months since my two surgeries. Um, my urologist didn't seem to be overly concerned with it. Um, it's just that it seemed to me this morning when I called an ambulance that there was much more blood than there usually is. And they did a urinary sample and did some blood tests. I didn't have any serious blood loss. I wasn't bleeding internally. Um, and there was no microscopic levels of blood in my urine. So they cleared me and discharged me from the hospital. I went to the hospital about 4:30 in the morning, and I made it home around noon. And I managed to keep my daily schedule today because that's important. I'm still suffering from a lot of physical pain, um, which we don't know what's causing it. My psychiatrist was withdrawing me from Neurontin, which may have added to rebound physical pain because Neurontin is often used to treat neurological pain, and the withdrawal from it can actually cause pain. And so I'm back on the Neurontin, 600 milligrams 3 times daily in the form of 300 milligram dose tablets or capsules. Um, I have a lot of pain in my physical extremities, especially my legs. It's very difficult to walk on my legs. It hurts a lot. My arms, my joints, my shoulders, my hips, my back, they all hurt. Um, the pain is a little less severe today than it was, say, 2 or 3 weeks ago, but it's still pretty strong, and we're not sure what's causing it. They referred me to physical therapy, which I'm beginning on January 26th. I'm seeing my primary care doctor on the 21st of January. On the 20th of January, I'm seeing my psychotherapist. And on Tuesday of this week, I will be going to group therapy, assuming that an upcoming snowstorm, which is predicted, doesn't block that group from happening. Um, it wouldn't be totally a surprise if a snowstorm does hit Rochester this week. It is January. It is cold outside. I live in New York State. There may be a snowstorm coming, and it might disrupt bus routes and bus travel, which is how I get around usually. If the buses are not running, then I can't make it to group, even if the group is being held. Last week's group was canceled because the therapist couldn't make it into the clinic, And so we canceled last week's group therapy. It's supposed to be a group therapy that lasts for 10 weeks. So far, I've only been to 1 week. The second week was canceled, and we'll have to see what happens this Tuesday with the weather. With the upcoming group this Tuesday, which is day after tomorrow. The goal of the group is called dialectic behavioral therapy, or DBT therapy. It's meant to help mental health patients or clients, or whatever word you want to use, to withstand stress and strain better without panicking or falling apart. Stress tolerance levels uh, to increase, that kind of thing. Um, DBT therapy is supposed to build tolerance for both internal negative turmoil and external negative turmoil, and to be able to withstand it better without falling apart or going to the psychiatric emergency room or doing dangerous self-harming behaviors or suicide or drugs or alcohol or anything like that. Just being able to withstand highly stressful situations, both externally and internally, in regards to symptoms of one's particular mental illness. Of course, I'm not allowed to talk about the details of what goes on in the group. That's confidential. But I have 9 more weeks to go with group therapy. I've been seeing my psychotherapist about once every 2 weeks, and my next psychiatry appointment isn't until February 3rd, 2nd or 3rd, I forget which one. And in a little while, I will be doing some meditation to calm down. I will take some Zyprexa and some Klonopin first, and then later I will take the rest of my night meds and try to get a good night's sleep. It's been a rough day. Right now, my auditory hallucinations are pretty much under control. I've already taken my daily meds for today. I haven't taken my night meds yet. The Zyprexa and the Klonopin helps control the anxiety, and the Zyprexa helps control the auditory hallucinations without totally eliminating them. I'm still on 600 milligrams of Seroquel and a host of other medications. I just saw my gastroenterologist, and she added a medication for heartburn that I get when I lie down to go to sleep. But that's taken as needed. It's not a required drug that I have to take on a regular schedule. So it's been a real busy day. My depression is pretty much under control. My anxiety is pretty much under control. My auditory hallucinations are pretty much under control. My paranoia and delusions are pretty much under control. I don't feel suicidal. I am angry about the physical pain I'm going through. Nobody seems to know what's going on, including myself. Um, but other than that, I guess I'm doing okay. My legs really hurt right now. I did get on my exercise bike to try to exercise my legs. Part of dealing with my physical pain is sticking to my daily schedule, including the physical part of my daily schedule, because physical therapy is going to be a big tool in approaching the pain that I'm having in my back, my arms, my legs, my muscles, and my joints. And exercise, even if it's unpleasant and uncomfortable, is a necessary way of dealing with the physical pain. And if for some reason that doesn't work, they'll refer me to the Pain Clinic Treatment Center here in Rochester, New York. But that's all the report for now.